Welcome to the New Jersey Department of Health Infection Control Assessment and Response video series. This is the third of 3 videos, Injection Safety. Let's learn about safe injection practices in the healthcare setting.
Safe administration of medications is important to patient safety. When preparing medications, remember aseptic technique is important. Make sure to remove the dust cap and disinfect the top of the vial. Wait for the sari to dry before inserting the needle. It is important that you use 1 needle, 1 syringe each time. If you're using multi-dose vials, reusing a needle can contaminate the medication. You can see that sometimes a single-dose vial and a multi-dose vial look similar and may be the same size. However, be sure to read the label because they are different. It will say on the vial single-dose or multi-dose. Single-dose vials are preferred in healthcare to prevent contamination of the medication. However, that medication may not always be available in a single-dose vial. Make sure you read the label before drawing up your medication. And also make sure you follow manufacturer guidelines for use and storage of a medication. Single-dose vials contain no preservative. Entering a vial multiple times may contaminate the medication. Do not enter a single-dose vial more than 1 time, even if there is medication left over. Multi-dose vials are formulated so they can be re-entered multiple times. However, it is important that you use a new needle and new syringe each time you enter the vial. Once you drop your medication, it is important that you label the syringe with your initials, the date, and the time that the medication was drawn. It is also important that you label the medication vial with the beyond use date for a multi-dose vial, which is 28 days or according to manufacturer guidelines. This does not apply to single-dose vials as they are discarded after each use. It is important that administration of medication occurs within 1 hour of drawing up the medication. Basically, you want to administer the medication as close to as having drawn it up as possible. Never leave a needle, cannula, or spike inside of a multi-dose vial. And lastly, IV bags. IV bags are meant for single use. They should not be accessed multiple times. A better option would be a single-dose IV flush. Patients depend on us to provide good, safe care and to follow best practices when it comes to injection safety and medication preparation.
Now that you've watched the video, start a discussion about safe injection practices to ensure patient safety.